Squirt, squirt, uses, gives back, grab it with your left, and start going with the next instrument. Give, bring your place down, squirt, squirt, be ready to take with your left. There's going to be a lot of this going on, guys. Very sure. There's a lot of movement. What you got to watch out is not to touch the microscope. Okay? Same thing with the surgeon. If you're a surgeon up here, guys, you're not supposed to be looking up. I should have covered this with tape. But you're supposed to be looking straight down on the patient. Okay? If you look up, here's what happens. Anytime the surgeon looks up, they lose their point. Okay? Especially during microscope, they lose where they were looking. Have you guys ever seen a plane in the air? And then you look away and you're like, where to go? You have to really focus. Where to go, where to go, where to go, where to go. Oh, there it goes. You don't want that happening during surgery. The surgeon needs to be on point at all times. So if they have to take their eyes off of the microscope and ask you, where's my instrument that I need? You're in trouble. You just delayed the surgery, and they're going to have to go back and find that finite point that they needed to finish the surgery, okay? So don't let the surgeons take their eyes off the field. Please be safe as you can when you're up here, okay? Try to pass these as best as you can. Doctor, don't give things back, give them back properly, like you were shown how to pass things. Because this is the point, and the only surgery really where you don't have to, or you shouldn't have to bring a basic, because on that point the doctor will also have to look away. It even says in your book, this is probably the only surgery where you're going to have to receive instrumentation back. So please, if you're the surgeon, pass that knife back properly so that person can grab it and set it down. Also, whenever you set down little sharp points or anything, set down the non-sharp point down first, then the other. I've seen a lot of people contaminate during this. You'll see there's a lot of little pecks because they ended up placing this down first. And what happens is now becomes a strike through and a contamination. Okay, so make sure you put that down and then let the rest fall. Again, fall. Okay, as best as you can. VSS, whenever you guys can. All right. Why is the needle holder up here? Any particular reason? Cataract surgery. Any particular reason?
For the suture?
Just in case. We don't use suture, right? Yeah. Unless you need to close it, you made a big mistake. So it's up here just for that emergency case. Okay? And then you got your lens inserter, blah, blah, blah. Extra tip for BSS. More than likely you'll have 2 of these up here. And then again, wax cells are pretty much your sponges of the case, right? Usually used during the end of the case. All right, so you're gonna be going in that order. If you don't know surgical tech, just pass in that order. Try not to get it confused, okay? In that order only. This is here just in case. This is here to clean instruments. Please don't wipe your eye instruments. There's a lot of sharp parts and you'll cut yourself. So what you want to do is at least drag the instrument through the micro wipe if need be. Don't worry about that part today, but it's there so you can practice. All right, so we're gonna be doing that. I'm gonna play surgeon first and I'm gonna have the first tech up there. But first, I want you guys to grab all new sets of gloves and I'm gonna see you guys open glove. So let's go ahead and grab some gloves. Woo.